The AFl-CIO and other unions in the Workers' Committee for Blood Safety represents phlebotomists, nurses, and drivers employed at the American Red Cross. These workers take safety very seriously, but over the past few years, they have seen a disturbing trend. The Red Cross has pursued workforce cost-cutting measures that result in running blood drives like fast food restaurants. That is a major threat to blood safety. Workers report that Red Cross frequently understaffs blood drives, assigns workers to 14-hour days, as we heard previously, and eliminates the most experienced, licensed medical personnel. These labor practices have created a low morale, high turnover in the workplace, increasing the risk of blood safety errors on the job. Employees are responsible for unloading heavy equipment, assessing donors' health histories, conducting many physicals, collecting blood, and caring for donors after they give blood. This is serious work. But Red Cross employees report that understaffing makes it particularly difficult to ensure safety on blood drives. The problems of overbooking and understaffing are systemic. We believe this reflects a policy decision by Red Cross to abandon attempts to retain qualified staff. Red Cross has been eliminating or reducing the number of licensed nurses who work blood drives. In several regions, workers report that licensed nurses have been cut by as much as 2/3 over the past 10 years. This trend presents safety issues for both donors and transfusion recipients. Nurses are most qualified to respond to adverse reactions, including fainting episodes, injuries caused by needle punctures, allergic reactions, and complications associated with double red procedures. When a judgment call is needed to determine whether to turn down a donor, we believe that nurses have the experience to make the best decision. A nurse who has worked in a neonatal ICU, for example, has a real-life understanding of where the blood product is going. In some areas of the country, Red Cross has taken mobile truck drivers and trained them as phlebotomists. Some of these workers have told us they're not comfortable being responsible for drawing blood. They don't have the experience or training to provide the best possible response if an urgent medical need arises. Now, I've painted a broad picture for you this morning. Now, let me tell you a few specific examples. In Connecticut, Red Cross is currently trying to eliminate staffing ratios that the union believes provide greater safety, as well as reduce the responsibilities and authority of nurses. Workers report to us that 4 years ago, Red Cross in Connecticut had 30 nurses on staff. Today, it is down to 11. In Michigan and California, Red Cross is attempting to reduce the responsibilities and authority of nurses. In California, Red Cross and other blood banks even received an exemption from state laws that require certification for phlebotomists. In the New Jersey Penn region, the industry has lobbied to eliminate the requirements for nurses on blood drives. We've received reports that 10 years ago, Red Cross had 75 nurses on its blood collection staff. Now they are down to 18. These practices are especially problematic when you consider that the American Red Cross is the largest supplier of blood and blood products in the United States, controlling more than 40% of the U.S. blood supply. Red Cross is well known as one of the largest disaster relief organizations serving domestic and international communities. Blood drives are a big business for the Red Cross. In 2009, the Red Cross had $2.2 billion in revenues from its biomedical operations. While blood collection addresses a critical medical need, the Red Cross has a bad safety compliance track record that must be remedied. Since 1993, the Red Cross has been under a federal consent decree to improve its blood safety practices because of continuing compliance problems. The consent decree was amended in 2003, allowing the FDA to fine Red Cross for violations. Since 2003, the Red Cross has been fined $21 million for repeated safety failures. Decisions on a new round of fines are currently under consideration at the FDA. We believe that fixing its workforce practices is key to fixing the safety problems at Red Cross. The AFl-CIO stands in solidarity with all Red Cross workers who are fighting for fair labor contracts and working conditions that improve blood supply practices. If Red Cross wants to improve blood safety and their record, they must invest in their workforce. Trying to run blood drives on the cheap is not good for blood safety and not good for ensuring an adequate blood supply. We understand very well how important blood donation is to the health of our nation. That's why the labor movement is consistently one of the most reliable partners in blood collection, regularly asking all labor union members to roll up their sleeves and donate blood at trusted outlets. No one should have to worry about the care they receive when they roll up their sleeves to give blood, and no one in need should have to worry that the blood they receive could actually hurt them instead of helping. American Red Cross must do better. Thank you.